are Rita Kelleher and Patty Mack. First, I just wanted to wish everyone a Happy New Year. I hope you all had a relaxing and safe holiday season. I'd like to go ahead and just do a quick roll call. So when I say the name of your school, please just let me know who is joining from your sub-project. I'll start with Harvard sub-projects 1 and 3.
This is Marcia Testa.
And Elena Savoya.
Thank you. And as a reminder, if you're not speaking, please go ahead and mute your phone so that we don't have an echo. Okay, well, Washington sub-projects 2 and 3.
Luann D'Ambrosio.
Hey, Rachel. You also have Janet Baseman, Deborah Revere, and Molly Fader from Subproject 3.
We will now mute.
Thank you. How about Albany?
Gus Burkhead from Albany.
Okay, thank you. And we're still having a bit of an echo, so please just double check your phones. Arizona?
Brenda Granil with Arizona. Sorry, we talk over each other. Brenda Granil and Tara Chico Jarillo.
Thank you. Emory?
Yep, this is Allison Chamberlain and J.D. Leonard.
Thank you. Pittsburgh?
Hi, it's Elizabeth Van Ostren.
Thank you, Elizabeth. And UCLA?
This is Andrea Martel.
Great, thank you. And who on the line do we have from CDC?
Good afternoon. And good afternoon. This is Tracy Thomas.
Thank you. I feel like we still have an echo. Brian, is there anything that we can do?
It seems like someone who is on their phone needs to mute the phone, which is causing the echo.
Okay, thank you. So just get another reminder to please go ahead and mute your phones if you're not speaking. We also have representatives from NORC on the line today. So can I please find out who on the line is joining us from NORC?
Yes, you have Michael Meat, Noel Musfeld, and Deborah Backman.
Great, thank you so much. All right, well, as you hopefully saw in my email earlier today, NORC will be providing an update on their work, which includes an updated set of draft evaluation questions. Before turning the call over to them, our CDC colleagues and I do have a few brief updates. In addition, I've asked those grantees who have completed their site visits with their project officer to provide a brief overview of those visits. So I will go ahead and get started for our ASPPH updates. And Brian, if you can advance to the next slide, thank you. Starting with the 2017 Preparedness Summit, session acceptance notifications were sent by NACCHO in late December. We will be collecting information about each of your sessions to share broadly, so please be on the lookout for an email from me requesting details about those sessions. Additionally, on an upcoming grantee meeting, we will take some time for each grantee to share details about your sessions. Also, we're proud to let you all know that ASPPH was accepted for a poster presentation that will highlight your products. So in the coming weeks, I will be reaching out to you for information that I can include in that poster. Also, as a reminder, we will be holding a one-day grantee in-person meeting on Monday, April 24th. We anticipate beginning at 10 a.m. and concluding at 5 p.m. Please ensure that each sub-project has at least one representative in attendance. And in addition, our colleagues from NORC will be participating as well. Also, we are in the process of discussing the possibility of pursuing a journal supplement with the American Journal of Public Health. The purpose of this journal will be to document your contributions made to the public health preparedness workforce and to highlight the progress made by your project to address the translation gap from research to practice. Once we've had a chance to discuss the logistics with the journal, we'll reach out to all of you with more details, including information about the expected deadlines and abstracts. We anticipate hopefully starting late spring, early summer, and working to get those articles completed. And then finally, thank you all for submitting your project updates that we will share with the advisory group this month. We're currently finalizing that document and may contact you for clarification purposes or just to gather a little bit more information. And I'll stop there to see if anyone has any questions about either the journal supplement or the Preparedness Summit. All right, hearing none, I will go ahead and turn the call over to Shaukat and Mary for a couple of CDC updates.
Thank you, Rachel. Can you hear me well?
Yes, we can. Thank you.
Oh, thank you. Good afternoon. For the item CDC updates, I will give a brief update on OPHPR practice-based research agenda, maybe for 5 minutes. And then Mary will talk about CDC clearance requirements, procedures, and timelines, maybe 5 minutes back. OPHPR practice-based research agenda draft was shared with Board of Scientific Counselors last month, and based on their input, the agenda is being further refined. We are expecting that OPHPR will finish and release a final research agenda in the next couple of months. Due to time limit, I will not talk about the activities that were undertaken to produce the list of priority research questions or read all the research questions. What I will do, I'll read some research questions as examples that are listed under each of the 7 domains. Related to domain biosafety and security, the questions include what criteria should be required to ensure entities have inactivated biological select agents and toxins effectively. What types of evidence are necessary to determine the inactivation effectiveness? And there are some more questions. Let me go to the domain biosurveillance. The question will be like, what type of information needs to be shared between the organizations participating in emergency response to support situation awareness for decision-making and risk communications? What surveillance and information systems and data sharing policies or protocols need to be in place to support effective information sharing? How does this vary by hazard and at the state and federal level? I just want to let you know that these research questions are being refined and will be released sometime soon, so we will let you know at that time. About going to another domain, which is community resilience, some example questions are what public health system characteristics, capabilities, or activities mitigate physical and mental morbidity and mortality associated with public health emergencies or disasters? What is the cost benefit of the activities intended to reduce physical and mental morbidity and mortality associated with public health emergency disaster? Related to countermeasures and mitigation domain, the questions are what methods and metrics can be feasibly and effectively used to evaluate medical countermeasures, dispensing, and distribution programs for effectiveness. Do these methods allow estimation of surge capacity for countermeasure distribution? What are the most commonly used IV pumps for medication administration for both adults and pediatric patients? Related to incident management, we have research questions. What methods have been used to conduct jurisdictional risk assessment for the purpose of public health emergency preparedness and response planning? How has jurisdictional risk assessment information been used for public health preparedness and response decision making? Related to information management, research questions are to what extent do public health agencies implement effective or evidence-based risk communication practice during emergencies? To what extent do emergency risk communication messages contribute to outcomes of interest such as protective health behaviors or changes in policy or practice? Related to surge management, some of the priority questions are: what routine services, if any, do public health departments, hospitals, and healthcare facilities continue to provide to the public during and in the aftermath of a public health emergency? These are some of the examples of the type of questions which have been prioritized under different subdomains. And as soon as the document is finalized and cleared, I'll be sending it to ASPPH so that it can be posted on the web page. And we will also let you know that once the document is available. Any questions?
Thank you, Shaukat. Appreciate that update. And I believe Mary had an update as well.
Yes, thank you. Can you hear me?
Yes, we can. Thank you.
Great, thank you. Good afternoon, everybody. I guess it might still be morning on the West Coast, so good morning as well. What I want to do is just take a couple minutes to advise folks about requirements if you are going to collaborate with CDC employees such as Shaukat, myself, or Tracy, or anybody else here at CDC as a co-author. And this would include conference abstracts, conference presentations, as well as scientific papers. This has come up a couple times, and I just want to make sure that you're aware that anything that has the name of a CDC employee on it has to go through the CDC scientific clearance process. And so this adds additional time at the end of paper development before it can be submitted to a journal, and it's particularly important for deadlines for things such as journal supplements and special issues, as well as deadlines for submitting conference abstracts. So the purpose of the CDC clearance process is to achieve really high standards of excellence in science and to make sure that scientific documents have the most credible, high-quality science in them in order to have high impact on public health. So it's about the quality and integrity of the science, and it's also about the policy implications of the science in the paper. So let's see. I've got several bullet points here. I'm trying to figure out which one I want to talk about first. There are three different things that can happen in the CDC clearance process. So what happens is there are reviewers that need to review the manuscript, and they will either clear it or they may pass back some comments, which would be an outcome of conditional clearance, where the authors may need to make some fairly small revisions, which can then be made and submitted and finalized. It's also possible that a manuscript may not be cleared or that it may be returned for major revisions if there are significant concerns about it for whatever reasons. So I think it's unlikely, or it doesn't happen very frequently, that a manuscript is either not cleared or is returned for major revisions, but it's something to keep in mind. It's important to have a finalized and polished version of any manuscript or conference abstract or any document to submit to clearance. So it's not something that can really be done at the same time that you're doing the final editing and revising of the paper. It really needs to be done after that, so it's additional time. And the process generally involves 2 or possibly more levels of review. So, for example, if I'm going to collaborate with someone on a paper from outside of CDC, it first needs to be reviewed and cleared and commented on by my supervisor, which is Eric Carbone, our program director, and then it goes to our CDC clearance or our OPHPR clearance official. So both of those levels of review have to happen before it comes back to me to then deal with any comments or considerations that come up. And so then time needs to be built in to respond to any reviewer comments and then resubmit. And if there's significant comments, they'll have to be reviewed again, so that could also add to the timeline. Some factors that may affect the length of time needed for clearance include human subjects research oversight considerations. So if the paper does not involve human subjects research, then that makes it easy. But if it had involved human subjects research, and that includes exempt research, all of that would need to be documented. And if it actually involves data collection, it may require some additional level of CDC IRB involvement, particularly if your CDC co-author is actually involved in data collection or analysis, which often is not the case. But in any case, it's important and a good idea to start thinking about these things up front when you're starting to anticipate what papers you might want to publish and who you might want to collaborate with to start dealing with some of these things along the way. Let's see. So yeah, the size of the document, the complexity, how well written, how polished it is can affect how quickly it gets cleared. Obviously, the more well written it is, the easier it should be for the reviewers to read and decide what the scientific and policy implications and considerations are. If the findings or the implications of the paper are particularly controversial or impactful, that may also affect the clearance process and is probably more likely to result in the need for some revisions in order to refine the message and the implications and make sure that they are worded clearly and have the appropriate impact. Some papers may need to be cross-cleared by other CDC offices. So that could include other divisions of OPHPR, such as the Division of State and Local Readiness or the Division of Emergency Operations. If the paper addresses some substantive topic that's really within their purview, then there would need to be review by someone from there who's a subject matter expert, in addition to our review at our level and then the OPHPR clearance official. Sometimes papers may need to be reviewed by other centers at CDC. So, for example, if you have a paper dealing with like the H1N1 pandemic, that would have to be cleared by the National Center for Infectious Diseases, or Infectious and Respiratory Diseases, which will add at least an additional 2 weeks of clearance time onto the clearance process for OPHPR. Let's see. Of course, time also needs to be built in for the CDC co-author to be able to review it and make any changes or suggestions or comments to their co-authors on the paper before and finalize it before submitting it to clearance. And another thing to consider is crunch time, such as if there's a submission deadline for a journal special issue or for conference abstracts, that will increase the volume of things that are trying to get through clearance all at the same time. So we do try to keep that in mind as we submit things. So with that in mind, it's always a good idea to work with your CDC collaborators and have them consult with the clearance official in advance to let them know that there's something coming down the pike, and that to get a sense of what the timeline might be, and also to check, for example, make sure like that Eric Carbone isn't going to be on leave for 2 weeks or something else like that is going on that might slow down the process. So again, it depends on the size and complexity of the document, but generally it's probably a good idea to plan for at least a week just for OPHPR clearance if it's just the 2 levels, and it could be an additional 2 weeks beyond that or more if there's cross-clearance by 1 or more other CDC offices. So I'll stop there to take questions and also offer Shaukat and Tracy the opportunity to chime in with their experiences with clearance on any documents on which they've collaborated with anybody from outside of CDC. So I guess we'll start with questions from the sub-awardees and from ASPH, PPH.
Hi, this is Gus Burkhead from Albany. Just to clarify, what you've been talking about in terms of clearance is only if we have a CDC employee as a co-author. Is that right?
Correct.
So we've submitted abstracts to the NACCHO Preparedness Conference, but without a CDC co-author, we don't need to clear those through anybody. Is that correct?
That's correct.
Thank you.
And this is Allison, Mary, from Emory. Adding you guys as named in an acknowledgement section if we have not started enough far in advance to get you guys as co-authors in certain cases. Is that okay?
Yeah, you can work with us or with whatever CDC employees that you're working with to do that. So yeah, that doesn't us getting in an acknowledgement section doesn't require any kind of CDC clearance. It's just a matter of an agreement between a collegial agreement.
Okay. And another question too, if Shukit or anyone else has examples of where this has worked out well and you guys have been co-authors and it's gone through the review appropriately, any sort of comments on previous experiences that have worked out?
This is Shaukat. We have one paper where we have collaboration outside CDC. This is not related to WIP. Any of these WIP projects. That paper, that manuscript was cleared at the university level on that end, and at CDC level we also submitted it to our science office for clearance, and it doesn't take much time if the content doesn't need much refining or revisions. But as far as the process is concerned, if manuscript is well written, there are not significant commenters. It takes them a few weeks.
Thank you.
All right, any other last questions for Mary? All right, thank you so much, Mary and Shaukat. That was very helpful. All right, so moving along, I wanted to give a couple minutes for those grantees who have hosted site visits for their CDC project officer just to share some information about these visits, specifically calling out any action items or collaborative projects that were discussed. I believe we have three, Harvard Subproject 3, Washington Subproject 3, and Arizona. So if Marcia, I can start with you if you just have a couple points you'd like to share with the group.
Certainly. So our site visit was held on October 25th, and I thought it was a great time not only to have a visit from Shaukat and get feedback, but also to bring the group of the 5 leaders of our sub-projects together, Dr. Elena Savoya, Paul Bittinger, Michael Stotu, Bish Vishwanath, and myself, along with 10 of the 13 team members, actually. So it was sort of a one-day retreat as well. I think some of the major points for collaboration, we got some feedback recently that might be interested along with Dr. Stoto's Critical Incident Management Project in putting together a workshop in 2017 on Zika after action reports. So we're planning, we had a meeting yesterday to go forward with that connection, but also got some wonderful feedback from some of the people who are part of our stakeholders group, the president of the Mass Association of Health Boards, a representative from one of our local health departments, and another person from the Massachusetts Metropolitan Planning Association, their public health division. So all in all, it really was very useful, not only as a site visit, but also as a general meeting for us getting together and discussing issues and how we can collaborate further and some of the help that we can get from the CDC. So I thought it was a very useful and productive meeting.
Great, thank you, Marcia. Janet or Deborah, would you like to share some information about your site visit?
Sure, this is Deborah. Shaukat came to, ventured all the way across the country to Seattle on December 8th, and the day that we spent together was a combination of review of our project objectives and accomplishments, upcoming activities. We had, and it coincided with the meeting of our Regional Network Steering Committee. In addition, we had visits from the Northwest PERC researchers who presented a variety of the different projects and ongoing building on those projects that is occurring out here. We also had 2 of the 11 public health agencies that are our collaborators on this project who attended a working lunch, and we had discussions around their accomplishments and timeline and upcoming activities that that they're engaging in with us. And it was a great day for us. It was great for us to meet face to face, and we also had meetings with the Northwest Center for Public Health Practice. Luann, the Associate Director, who's also involved in this project, presented about the activities, other activities going on in the region that the Northwest Center for Public Health Practice is engaged in training and evaluation. And we discussed kind of continuing and future collaborations with all of our various partners, stakeholders, and CDC. One thing to point out is at the conclusion of this project, we will be, as part of our project activities, we will be holding a synthesis symposium, which will be a synthesis of all of the findings and work that's been done on the Percolate project. And in the invitations for that, which will happen sometime in early summer of 2017, will be extended to all the grantees, everyone at CDC, NORC, our Regional Network Steering Committee, group of subject matter experts who have been critical in advising us on high priority tools and trainings that have been generated from the PERCs and PEARLs, and all of the public health agencies that are participating in this project. That's it.
Terrific. Thank you so much. I look forward to learning more about the symposium. And we'll move on to Arizona. Brenda, I believe you're on the line.
I am. How are you?
Great. Thank you
so much. Can you hear me?
Thank you so much.
Okay, great. So Dr. Kari came out to Arizona on December 20th. So I think that was deliberate because our weather is nice and warm in December, but it was a great full-day retreat as well. Our primary emphasis was really on bringing our tribal partners into the meeting, and we had a really good in-depth discussion roundtable focusing mostly on some of the challenges that are still existing with our regional partners, and more specifically on tribal lands. So I think it was a good opportunity. So I'll just highlight some of the overarching challenges and talk a little bit about the tribal consultation piece. Some of the major challenges are still around the sustainability of preparedness programs, funding, and then leveraging resources across jurisdictions. Some of the themes that came up were around the policy language from a congressional side to ensure that multi-state and multi-jurisdictional responses are allowable and effective. With respect to CDC assistance and involvement, it's recognized that many of the programs funded work with multiple project officers within the CDC. So we, continue to encourage that the project officers can maintain the dialogue, for example, with folks from DSLR who, fund the FEP awardees and who are also our constituents. Tribes need to be aware of and have access to state-assigned CDC representatives. There's a request that CDC representatives needed to be visible and active at the community level. With respect to tribal consultation, tribal input needed to be included from the very beginning. With respect to development of any policies or programs that are going to serve tribal nations. Tribal-specific meetings need to be considered to allow tribes to actively participate in decision-making processes. And input on how funding is distributed needs to be considered. We had a whole lot of other dialogue going on, but I wanted to focus on that because, again, we had a heavy emphasis on hearing from our tribal partners and some of the challenges that still exist.
Hey, thank you, Brenda. That sounds, sorry, there's an echo. That sounds like a very productive meeting. Shaukat, I know that you participated in each of these site visits and wanted to give you an opportunity to add anything.
Well, these site visits productive. We had direct interaction, and also was glad to see the progress of all the activities. And during the visit, there were identified some potential areas of CDC assistance or collaboration or questions, and I have been working with Harvard and other colleagues at CDC to see how we can address those questions or how we can provide any kind of assistance. And as far as the Washington and Arizona questions are concerned, I'm working with CDC colleagues over here and have noted some of the points where we can directly connect these institutions with CDC representatives. And during the visit, there were some questions which were out of the OPH or there were some which were out of the focus, out of the scope of our project. But I will be contacting relevant people about that, and I'll be getting back with our Washington and Arizona colleagues in coming days. And as was mentioned earlier, the overall thing was the sustainability of programs and funding. And as I had clarified during the meeting, that we are equally interested in sustainability of the programs and are looking into different directions how we can work in that area. And as far as the funding is concerned, we do not know what funding will be available, how much will be available, and even if it will be available, will the continuation of this translation activity will be on the priority list of the OPH. So at this point, we do not have clear idea about the funding or continuation of translation activities. About other specific points, I'll be contacting the PIs directly as well and their team after I get some feedback from OPHPR colleagues.
Terrific. Thank you, Shaukat. And we
Rachel?
also look forward to, oh, yeah, go ahead.
Sorry, this is Gus Burkett in Albany. We also had a site visit. Tracy Thomas came up and visited. It wasn't a full site visit, but she participated in a day-long training for training coordinators that we gave back in November. So I just wanted to not leave that line. We did have her come visit, and we had a chance to talk with her about our project while she was here.
Terrific. Thank you for sharing that. If you'd like to share any other information, we have a couple minutes.
No, that was basically it. Thanks.
Well, this is Tracy. I would like to add that I very much indeed appreciated and enjoyed attending the psychological first aid training that they had with supporting people in the field at both hospitals and state and health local departments on how they can really develop and implement PFA training policies. And I think the portion that I really enjoyed was that they had an active engagement portion of the training where they had to do scenarios. And I think, the attendees really had a new level of appreciation for the complexity, and the importance of doing psychological first aid training and why it would be important to implement a training policy at their respective organizations. So I really enjoyed attending. I was very happy to see firsthand and learn even more about it. And so I'll be sharing those materials with you all at ASPPH for then further sharing with the awardee. So please look for that communication where I'll share those materials.
Thanks very much, Tracy.
All right, well, sounds like a lot of very productive site visits the past couple months, and I know that others are being scheduled for the next few months coming up, so we look forward to hearing about those on future calls. So at this time, I'd like to go ahead and turn the call over. Yes.
Rachel, can I just add one more point, that the site visit reports are posted on ASPPH website. So in case anybody is interested, have a look on that and identify any collaboration areas or just for their interest. Those reports are available on the ASPPH website.
Yes, thank you, Shaukat, for pointing that out. I appreciate it. So now I'd like to go ahead and turn the call over to NORC to provide an update on their evaluation work. So I will go ahead and turn the call over to Michael.
Thank you very much. So we just want to provide a brief update on the evaluation. The big thing that we have been doing is the initial calls with all of you. And we held those calls in November and December. We've been able to talk to all of the sites now. First and foremost, we wanted to thank all of you for taking the time to speak with us. You've all been very thoughtful and gracious in sharing your time with us and have provided some really helpful feedback to us, both in understanding your programs, understanding the diversity that exists across the programs, and also providing some really valuable feedback to us on our evaluation design. So what we've done is we've taken that feedback and we have started to pull that into an evaluation plan with research questions. We wanted to describe that a little bit to you today and to share some of those research questions and get any feedback from you. The evaluation plan itself will follow a Donabedian model for evaluation where we look at the structures and processes and try to assess whether the structures and processes are in place that will then deliver the anticipated outcomes. So we're going to bucket those questions into those three categories of structures, processes, and outcomes, specifically focusing on assessing the extent to which the grantees have disseminated and accelerated the implementation of selected PERC and PEARL tools and resources among the public health workforce. And hopefully you'll see that reflected in those research questions. And again, we'll value your feedback on those questions either during today's call or those were sent out with the call material. So please take your time as well, and we will welcome any feedback on those at a later time also. The information itself will be collected from you, from the grantees, from the intended knowledge users, so your target audiences for your work. From potential knowledge users, we will be doing focus groups with state and local public health preparedness directors. From grantee partners and collaborators, from national public health organizations, and from the ASPPH Public Health Preparedness Advisory Group. And the methods for that data collection will be largely qualitative. We will be doing some document review, but most of the data sources will be key informant interviews, focus groups, and those focus groups will be conducted during the Preparedness Summit in April. So with that, let me turn to those main research questions. And I think we have them up on the slides, and we also have sent those out to you. So the big thing that we learned in our discussions with you is that you are all doing very diverse work across a number of different topics and focus areas, and the scope of the work that you're doing differs as well. And what I mean by that is some of you are focused nationally, some of you are focused regionally, some of you are focused on specific partners within a region. And that just created some challenges for us to think about how we evaluate this in a way that can be applied across grantees. And that's really what we're trying to address with the evaluation approaches here. And then as part of this, I think we also want to try to identify specific examples of promising approaches and best practices that can also be shared. So those are the things to look for in the evaluation questions. So what we have here, these are the first set of questions focused on the structures that have been put in place. And you'll see that the research question is on the left, and then we have the data sources on the right for each of those research questions. And again, document review will include the reporting back to ASPPH that you have provided. The grantees are interviews that we will be conducting with you. Knowledge users are the interviews that we will be conducting with your intended audiences. We will ask each of you to provide us with the names of individuals or organizations with whom we can interview as knowledge users. Potential knowledge users, you'll see some of the questions directed to them a little bit later. Those will be the preparedness directors that we reached through the focus group. The partners and collaborators will include your partners in your grants. National organizations will include national partners such as NACCHO and ASTO. And then the advisory group, as I mentioned, is ASPPH's advisory group. So the structural questions look at whether the grantees have put in place the structures necessary to support the program, whether the what the characteristics are and the salient features of the different grantee programs and projects, the characteristics of the partnerships that have been put in place, and then the types of inputs that the advisory group provided that help to guide the program. So with that, let me just pause, see if anyone has any feedback on the structure questions, and following that, we'll move then on to the process questions. Okay, so hearing none, we'll move on. But again, I will remind you that I know you have not had this for very long, so please take the time to review these, and we will welcome any feedback either by email, or you can feel free to call us as well at a later time. If we can move on to the next slide. So these are the process questions. So again, what we're looking for here is whether the grantees have implemented processes or put processes in place that support the goals of the program, the translation, dissemination, and implementation of PHPR tools and promising practices, the strategies that have been put in place to implement those processes, whether the processes align with project outcomes, intended outcomes, and whether the strategies support grantee project implementation. Again, we'll take any feedback now, or you can, of course, let us know at a later time, but I'll pause to see if anyone has feedback on the process questions. Okay. So hearing none, we'll then move on to the outcome questions, and we do have 2 slides worth of outcome questions. This is really going to be the main focus of our evaluation activities. We want to learn what the outcomes have been from the grantee project. So the first set of questions, and again, the 2 pages, the first set of questions are the extent to which the grantees have implemented their project as planned, what the grantees' accomplishments are since the beginning of funding, and the benefits that have been attained beyond those intended outcomes, whether the grantees' products have been disseminated among the knowledge users and the public health programs and workforce and how they've been utilized, evidence that exists that the advisory group inputs impacted the outcomes, and the methods that grantees used to assess the utilization, effectiveness, and replication of the PHPR outcomes and promising practices and the data that they collected. So I'll pause there, see if there's any feedback on these, and then we'll move to the second piece of the outcomes question. All right, why don't we move on to the next one then? So we're also going to be then looking at whether the best practices and program models have been identified, how knowledge users have utilized the grantee products, and what are the perceived benefits of these products, the extent to which the grantee products enable knowledge users to increase their effectiveness and the efficient use of resources, the perceived facilitators and barriers to accessing and utilizing the tools and promising practices, and then evidence of implementation of grantee tools and promising practices among public health programs and workforce. And I think from these questions you can see that really what we want to do through these interviews and focus groups is to try to tell the story of what the grantees have been doing with specific examples of the outcomes and outputs from the grantee program. So we really do envision this as almost an exercise of telling the story of the good work that all of you have been doing. Let me pause again, see if there are any questions on these or any of the other research questions.
This is Marcia Testa. I didn't want you to think that there's complete silence because we really have nothing to say about the good work that you're doing. But also, as you were presenting this, what was going on in my mind is that you've built a structure for evaluation that could extend beyond the end of these program grants. Is there, for example, to see how the continued use and implementation and uptake is beyond when people finish this year and 7.5-month project? Is there any thought about going on in that direction?
So that will be a question for ASPPH and CDC. So our contract is through or to August 4th. So we have built a timeline to do all of our data collection and reporting really to August 4th. So and it's really before that. So we need to complete our data collection roughly 6 weeks before the end of the project period so that we have time to write it up. So we're really going to be doing all of these interviews and data collection between now and roughly the middle of June so that we have time to do that analysis. So, I think that's a good idea and recommendation, however.
So yeah, what I was thinking of, the documentation of your process and the questions that you ask are another product of this, it seems, in addition to the data that you actually collect. So that's the suggestion. It wouldn't require going beyond the time period of your contract, just the documentation of the methods that you've presented here would be good.
Yeah, absolutely. And we will provide all of that. Yeah, absolutely.
Thank you.
Hi, this is Gus Burkhead in Albany. Thanks. That's a good presentation. Could you say a little bit more about how you're going to identify knowledge users and potential knowledge users, and how much are you going to involve us in each of the, we're a sub-project 3, so will you be asking us to help identify individuals, or what more will you be requesting of us in this?
Yeah, so it's a good question. So we will be doing another set of interviews with all of you, and those will be the formal data collection interviews. So that will be to inform our findings. As part of that, we are also going to be asking each of you to give us the names of a handful of your knowledge users, as well as your partners. And they may be the same thing. But we want you to help us identify people who are familiar with your tools and resources, who have been included as partners in using those tools and resources, and we will be doing interviews with them. So that's how we intend to identify the knowledge users. The potential knowledge users we see more broadly as the audience of public health practitioners, public health preparedness directors nationally. And we will be doing focus groups at the Preparedness Summit with identified preparedness directors from around the country to talk about the program and products and the kinds of resources that they have been using and what would be helpful to them to really see how that aligns with what grantees have been doing.
Any other questions for Mike? All right, and Mike, if people have comments after this call, what we can do is they can email me directly, and then I will forward that to you and your team at NORC.
That sounds perfect.
Great. Thank you. All right. Well, I think we are nearing the end of our agenda. We have a couple minutes left for any questions or updates from the grantees on the line at this time, if you have any. All right. Well, hearing none, thank you all for participating today. I think this was a very productive meeting. We will be scheduling another meeting in February, so be on the lookout for a doodle poll from me for that. And more information will be forthcoming about the Preparedness Summit and Journal Supplement as well. So thank you all again, and I hope you have a good rest of the day.
Thank you.
Thank you.
Thank you.